and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be talking about all the different types of wounds. But first, if you could please hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So pressure injury is going to be the first wound type that we go over. So what is a pressure injury? So a pressure injury is a wound over a bony prominence. Usually this is a deep tissue wound, and it can be with shear damage or without shear damage. So what is shear damage? It's when, say somebody's laying on a bed, a hospital bed. So the front of the bed, it lifts up and down. So sometimes patients start sliding down and there's also pressure there. So constant pressure, say on their bum, and that sliding motion of sliding, it can cause that shearing damage. So it can be pressure with or without shear damage. Now, pressure injuries, they do come in different stages. So you have your stage 1 through 4. You also have your unstageable and your suspected deep tissue injury. So your stage 1, this is your closed, it's not an actual wound yet, it's not open tissue, okay? So this, it's just intact skin, it's non-blanchable redness. So when you push your thumb on it, it doesn't go white. Stage 2 is when it actually opens up, so that top layer of skin is gone. Stage 3, this is complete loss of the dermis, so right down to the muscle. And stage 4, it goes down to the bone. Okay. Our unstageable, this is where we don't have a clean wound base. We can't see where the wound base because something is covering it, either eschar or slough. So that's, it's not your clean wound base. So that would be unstageable. We can't actually see how deep it is. Okay, and then our suspected deep tissue injury, this is purple or maroon coloration. And it is intact skin, but normally it is that deep tissue wound, and if it actually opens up, it's going to be down to the bone most times. It's going to be quite deep. So we do want to be getting these people. That's why Q2 hour rules are very important for somebody who is in completely in a bed, or if they're in a wheelchair, you need to be moving them every 2 hours. They can't be staying in a position longer than 2 hours because it will create these nasty pressure injuries. And then they're the hardest to heal because then we want to completely keep them off that area. It's not nice for the patient to go through. So next we have our venous leg ulcers. So our venous leg ulcers is caused by venous insufficiency. So what is that? It is when our blood isn't traveling back up to our heart properly, okay? So our venous system, our veins, bring the blood back to our heart. So this is when we normally see people's legs swelling. This is actually like #1 sign and prevention area to prevent these venous leg ulcers. If we're noticing swelling in somebody's legs, seeing if we can get them in compressions. If there's only venous issues and not arterial, compressions will work amazing. So we get that fluid moving back up the leg, prevents the venous leg ulcers, okay? Because that's venous insufficiency. The fluid is just pooling at the feet. Next, we have our arterial leg ulcers. Okay, so our arterial leg ulcers differ from our venous leg ulcers because our arterial leg ulcers is blood moving to our limbs. So the blood is moving to our legs. There is something impairing that, okay? So the blood is not, the nutrients, the oxygen isn't getting to the feet properly, and then it causes these punched out like ulcers. you've seen in the venous leg ulcers how it was very irregular and shallow. The arterial leg ulcers, it's almost a punched out look. They are normally quite symmetrical, and it has this punched out look. Also with arterial legs, they normally are very shiny legs and don't have hair on them because the nutrients isn't getting to the legs. We're not growing hair on the legs, so they're very shiny and almost hairless. Next, we have our diabetic foot ulcers. So our diabetic foot ulcers are caused by having diabetes. It's caused by diabetic neuropathy. So what that is somebody can't properly feel their feet. The diabetes has made their sensation in their feet go away. So they can't feel if there's a rock or any sort of thing going on with their feet. Even sometimes it's caused by a shoe. It's just not fitting properly. And it's rubbing, and it causes an ulcer. These are very, very hard to heal for diabetic patients, so prevention is a major thing. So we always want to be doing teaching, making sure that the shoes are being checked. There's not a nail sticking into them, a thumbtack or a toy or anything inside of the shoe. And then just making sure that they are getting proper care to their toenails because the nails do seem to get quite thick. So we just want to prevent any damage to the feet. Very, very important. Next, we have our malignant wounds. So a malignant wound is a cancerous lesion causing loss of tissue. Okay, so sometimes they can be like fungating wounds. It just depends, but it is an open sore caused by a cancer. Next, we have our skin tears and trauma. So this is loss of our tissue. It can either be partial loss or full loss of the skin. So as you can see here in the picture, this is a partial because there is a flap here, but sometimes it just rips that whole layer right off. So it just depends. And then trauma can be anything. Normally trauma causes skin tears, but trauma can really be anything, even up to gunshot wounds, whatnot. But it is loss of tissue due to some sort of trauma. Next, we have our burns, and so this is tissue damage caused by heat. This also does have different staging. Next, we have our surgical wounds. So surgical wounds can either be open or closed wounds, okay? So our surgical open, this is when a wound is left open to either drain. There's a reason why it has been left open. So you would normally heal this by packing, just lightly fluffing into the wound, and the tissue will grow upwards. Surgical closed, so either we have sutures or staples. It is closed. These are quite simple. They're covered with a dry sterile gauze for a couple days and then just left open to air. These are quite simple wounds unless they have complications. So that's all I have for this video. I hope you did find it helpful to learn about all the different types of wounds that you could have. And if you haven't done so already, if you could please hit that subscribe button, it would be greatly appreciated. And I'll catch you guys in my next video. See ya!